Alternative Treatments for Adolescent Depression by Alison Puriganan. Before reaching the age of 18, an adolescent has about a 1 in 7 chance of suffering from depression. Unfortunately, many of these teens will go untreated. Depressed adolescents are usually reluctant to express their feelings, talk about their moods, and/or seek diagnosis or treatment. Even when treatment is sought, conventional approaches may involve unpleasant side effects or high expenses like time and money. People who are depressed feel sad and hopeless, lose pleasure in their favorite activities, have sleep issues, weight changes, feelings of worthlessness or guilt, physical pain, and suicidal ideations. Traditionally, psychotherapy and pharmacotherapy are the main treatments for depression. Psychotherapy is talk therapy, and the most common form of it for depression is cognitive behavioral therapy, or CBT. CBT is a therapeutic method based off the concept that depressed people make cognitive errors that feed their depression. Pharmacotherapy is treatment with medication, usually with selective serotonin reuptake inhibitors, or SSRIs. Serotonin is a neurotransmitter that gives a sensation of well-being. SSRIs block the reuptake of released serotonin so it is active for a longer period of time. Unfortunately, the traditional methods for treatment have some big drawbacks. Psychotherapy can be time-consuming and costly. It requires an adult to provide transportation. The effectiveness also depends on the relationship between the therapist and patient. For teens, this can be tricky because it can be difficult to build rapport. Antidepressants have many side effects, the most alarming one being an increase in suicidal ideation and behavior, which the drug is attempting to prevent. Other side effects include nausea, diarrhea, agitation, weight changes, and insomnia. In addition, these medications require constant management by a physician. For teenagers, this can be a barrier because they need to have time for multiple doctor's visits and an adult's involvement. So clearly, conventional treatments have many potential disadvantages, so alternative treatments are valuable. The ones I will describe are omega-3 fatty acid supplements, exercise, and improving sleep. Omega-3 fatty acids maintain the fluidity of brain cell membranes and reduce brain inflammation. The only potential side effects are burping, heartburn, and loose stool. Exercise increases serotonin and endorphin levels, enhances the production of new brain tissue, and decreases inflammation in the brain. Exercise also improves one's self-esteem by the achievement of goals, enhancing body image, and potentially increasing social involvement. Adequate sleep is essential for general health, and many adolescents fail to get enough of it. Studies show that a person can increase their sleep by improving their sleep hygiene techniques, like regular bedtime and awakening time, sleeping in a dark, quiet, cool room, abstaining from eating just before bedtime, and avoiding caffeine. Adequate sleep improves depressive symptoms by increasing energy levels, decreasing irritability, and helping with concentration and memory. Obviously, the treatments discussed here are better than the conventional treatments for depression. Based on published research, a good routine to follow to reduce depressive symptoms would be: take 1 gram of omega-3 supplements, fish oil, over the counter per day with a meal. Exercise for 45 minutes, 5 days a week. Any kind of exercise is helpful, and teens should choose something they find enjoyable. And follow good sleep hygiene to promote adequate sleep. This routine should remain constant throughout one's life to lessen depressive symptoms and improve overall health.